Welcome to the Tennessee Heart Health Network webinar. Our aim is to be your resource for innovative statewide initiatives to improve primary care for all Tennesseans. We hope that you enjoy today's educational program and share it with your colleagues to make a better impact of heart health in Tennessee.
I'm Ashley Ellis, and I'm the Assistant Dean for Strategic Partnerships and Innovation for the College of Pharmacy at UT Health Science Center. I also am the Director of Practice Innovation for the Tennessee Population Health Consortium, and I am delighted to introduce some of our partners here for the Heart Health Network, as well as the College of Pharmacy. Our partners both for education and for residency at Good Shepherd Health. So we have two presenters here today. We have Michelle Zulu. She is the COO of Good Shepherd Health. She leads the efforts in optimizing pharmacy operations and medication management. She has a decade of experience in clinical pharmacy and healthcare administration. She's committed to enhancing medication access and reducing pharmaceutical waste through initiatives like Remedia Chain, and her work also extends to academia. She is an adjunct professor at Christian Brothers University, and she now serves as a preceptor for APPEs at UT, and then she also is dedicated to improving patient care and advancing the role of pharmacy in community health. We also have with us Dr. Philip Baker. He is the CEO of Good Shepherd Health here in Memphis, a pioneering pharmacist and a visionary founder. Good Shepherd Health was established in 2015, and the pharmacy operates with a mission to take medications and make them affordable, especially for underserved communities. Dr. Baker is also the architect behind Remedia Chain, an innovative program that reduces pharmaceutical waste by safely redistributing unused medications. His relentless advocacy led to the successful legislation of drug donation laws, making Tennessee a model for pharmaceutical sustainability. Dr. Baker's work has transformed healthcare access and affordability, benefiting thousands of patients while advancing environmental stewardship. He continues to be a trailblazer in the profession. So, really excited to hear about their topic today, which is a nonprofit innovations in medication access. This is a topic that is really important for patients in Tennessee. With that, I'll let you take it away. Thank you. Michelle.
Thank you so much, everybody, for joining us to learn more about our innovations that we've developed at Good Shepherd Health. I am going to turn off my camera so that I don't distract anybody. Okay. So thank you again for taking time to join us today and learning more about what we are doing here at Good Shepherd Health. Our goal is to improve access to medication and create meaningful impact on the healthcare landscape. As already introduced, my name is Michelle Zulu. I am a pharmacist, and I am the Chief Operating Officer here at Good Shepherd Health. I am thrilled to be joined by the founder and CEO, Phil Baker. He is going to be on the call assisting me with questions if there's going to be any at the end. We do have a lot to cover, so let's dive right in. Feel free to ask questions as we go along. We'll jot them down, and we will make sure that we address them at the end. So imagine this. Sarah is a 55-year-old woman with diabetes. She has worked her whole life, but recently lost her job and her health insurance. Now she's faced with a choice. Does she pay for her food, or does she pay for her medication? Without insurance, her monthly medication cost skyrockets to over $500. Sarah tries to ration her medications by skipping doses, but of course, her health declines. This is a reality for millions of Americans today. Does this sound familiar to you? Have you heard of people like Sarah? Are they maybe your neighbor, a family member, a friend? Let's start talking about chronic conditions. Well, let's start by talking about chronic conditions. Did you know that 6 out of 10 adults are living with at least one chronic condition? This is a significant part of the population that relies on consistent medication for their health. However, here's the challenge. half of those adults are non-adherent to their medication plans. Non-adherence is a major issue that affects outcomes for patients despite having access to medications they need. What's more concerning is that non-adherence is now recognized as the leading cause of preventable medical costs worldwide. If we can improve medication adherence, we can not only enhance patient health outcomes, but also reduce the financial burden on the healthcare system. So given all this, it is our job to improve medication access so as to have a better chance of impacting adherence. Many life-saving medications like insulin, cancer treatment, or even basic blood pressure drugs are becoming unaffordable. For those without adequate income or insurance coverage, people are either underinsured or uninsured, leaving them responsible for large out-of-pocket expenses. Even with insurance, we run into high deductibles and high copays, which can make medications out of reach. As a result, many patients are forced to skip doses, ration their medications, or even abandon treatment altogether, which could lead to worsening healthcare outcomes. In rural and underserved areas, pharmacy access is limited. Pharmacies may be scarce or unable to stock essential medications due to low demand or high costs. This particularly affects marginalized communities who face limited options and may be required to travel long distances or endure delays to get their prescriptions. To make matters worse, an alarming statistic shows that 9.3 pharmacies are closing every day this year, and this is half of those are independent pharmacies and the other half are chains. So they're further deepening the pharmacy desert crisis and worsening access to care. So Good Shepherd is tackling the barriers of underserved populations by combining digital health platforms, pharmacy services, and medication reclamation to create affordable and accessible care. Our mission statement here is to share the love of Jesus Christ through optimized healthcare. We have developed digital health platforms that improve community healthcare outcomes by increasing medication access and decreasing prescription waste. We aspire to help the members of our community, especially those who wouldn't otherwise receive the care that they need, manage their chronic conditions so that they can lead more productive lives. Good Shepherd Pharmacy is a nonprofit, closed-door mail-order pharmacy that operates independently of pharmacy benefits managers, PBMs. Instead of processing insurance claims, we use membership model, offering patients access to our inventory and ordering systems for a flat membership fee. Our formulary includes 160 generic medications that are covered by the membership. For any medication that is outside of our formulary, we provide them at wholesale cost with no additional transaction or dispensing fees, just the direct cost of the medication. By streamlining our processes, we've not only increased efficiencies, but also significantly reduced our overhead costs. Currently, we manage on average 300 patients using a single robot that handles about half of the prescription volume, alongside a lean team of one pharmacist, one resident, 2 remote technicians, and then anywhere from 1 to 5 fourth-year pharmacy students. Together, we fill approximately 2,000 prescriptions every quarter. Based on this model, we anticipate that we could easily double or triple our prescription volume with minimal additional personnel, as illustrated in this slide that shows the 1 robot, 2 pharmacists, 4 technicians, and 8 pharmacy interns. We focus on providing low-cost medication to uninsured, underinsured, and low-income patients. By leveraging a unique 12-week recurring cycle, we maximize efficiency in prescription fulfillment, allowing for bulk purchasing, which drives down drug prices. This approach lowers the cost burden on patients while ensuring a steady supply of medications, helping to overcome both high cost and limited availability issues. Group synchronization has truly been our secret sauce in aiding to our impact. By integrating digital health platforms that streamline operations and improve medication adherence, these platforms facilitate our inventory management, tracking our prescriptions, coordinating our deliveries, allowing us to reach patients in underserved communities more effectively. By using technology, we've been able to expand access to those who might not live near a pharmacy or even have reliable transportation. We are currently licensed in 32 states, managing on average about 300 patients, as stated earlier, filling 2,000 prescriptions. 160 of those patients get their medications delivered to their doorstep by a local partner that dispatches its drivers when requested. The delivery radius is about 20 miles around the Memphis area. Anyone that's outside of that radius gets their prescriptions in their mailbox, and we use USPS for that. This table outlines the net savings our members have experienced over a period of time, after accounting for their memberships from 2020 to up to date, quarter 3 of 2024. As you can see, even after paying membership fees, members have a significant amount that they are saving on their medications each year. For example, in 2020, members saved on average $715 per year, with a total of 600 patients that we were managing and over 21,000 prescriptions filled. Over time, the number has decreased slightly, and the net savings, however, has actually increased. Because as we know, drugs don't generally always get cheaper, they get more expensive. We saw savings rise to $1,100 per member, and despite further reduction in patients in 2022, that saving remains pretty strong, with $889 being saved by each member. Fast forward, last year, our members saved an impressive $1,041 on average. And as we look at this year in the third quarter already, we are only managing 299 patients constantly. And with those, we've filled over 10,000 prescriptions, and members are still saving a projected of what looks right now, year to date, $750. This data underscores the value of our program in helping patients save significantly on their medication costs. Even after factoring in the cost of membership, the savings year after year demonstrates how our model continues to provide affordable medication access for our members. As you've seen, Good Shepherd Pharmacy is transforming the way we approach medication access and affordability. But our work doesn't stop there. In fact, we've taken this mission even further with Remedy Chain, an innovative platform focused on reclaiming unused medication to help even more patients in need. Now let's take a closer look at Remedy Chain and expanding the impact of our work by creating sustainable solutions for medication access, but also addressing medication waste. Our medication reclamation and recycling program is a key initiative that collects unused, unexpired medication, particularly high-cost drugs like chemotherapy treatment, and redistributing them to individuals in need. This not only helps to reduce medication waste, but also ensures that essential treatments reach patients who might otherwise struggle to afford them. By combining affordability, accessibility, and sustainability, these solutions work together to make sure that people can access the medication they need, regardless of their income or location. In 2017, we took a groundbreaking step by championing the original legislation that enabled us to accept donated medications from individuals, not facilities, but individuals across the United States. We identified a simple yet powerful solution to a significant problem, one that could create life-changing opportunities that were very much aligned with our mission. Once the law was passed, we began collecting unused medication from various sources. Although the active matching process didn't start until 2020, the results since have been remarkable. Here are the numbers that we have achieved so far. This slide just pretty much showcases Remedy Chain's overall performance since the active matching began in 2020. As you can see, we've reclaimed nearly 4,000 medications, which represent a total of the unused, unexpired, pristine medications that we have collected over the past few years. Out of those, we've successfully matched 932 medications with patients in need, helping them bridge the gap between access and affordability. Unfortunately, some of those medications do expire while they're in our hands. So we have to get those destroyed. And that represents about 1,200 medications that have expired over this time. Currently, we are maintaining about 1,800 medications, but this is year to date to 2023. That number has actually increased because I don't have data for this year yet. Ensuring that we are well positioned to continue supporting patients across the country with access to life-saving medications. This growth highlights the increasing success of our program year over year and underscores the impact we are making in reclaiming medications that would otherwise go to waste. So in the previous slide, you guys got to see the raw numbers. Now I want to address the financial impact. If you look at this, this is the retail value of those medications. So we've reclaimed a total impressive amount of $37.7 million, which corresponds to those 4,000 medications. Of those, $9.2 million in value has been successfully matched to people that otherwise would have gone without this life-saving treatment. However, just like you saw with the medication count, we also had a loss of about $13.8 million worth of medications that we had to destroy. The good news is, by end of 2023, we still had over $20 million worth of medication in active inventory, and that number, because I did take a look right before I started this, is sitting at $25 million in our Remedy Chain closet, ready to be matched and shipped out. Together, these slides show not only the scale of medication reclaimed, but also the financial value of those efforts, underscoring the real-world impact we are making in helping patients access treatment otherwise they couldn't otherwise afford. This slide shows our inventory management application that we do use, the core platform that we use to manage Remedy Chain program. This system enables us to efficiently track and manage all the medications that are donated, available, and dispensed through the program. You can see how we categorize each medication status, whether it's available, destroyed, or transferred. Transferred meaning it's been dispensed. Each entry includes very important details such as the drug name, the dose, the quantity, expiration date, and even the lot number, because we do want to trace back who gave it, who did we give it to. Being able to always have that information at our tips is being vital. Using this platform, we ensure that no medication is wasted and that we are quickly able to match any available patients that are in need. It allows us to maintain transparency and streamline operations, providing real-time data to monitor our inventory and donations. As you have just seen, Remedy Chain is focused on reclaiming and redistributing unused medications to those who need them most. Our mission is to improve medication access. Our mission to improve medication access doesn't just stop right there. In fact, we've developed another innovative solution to address the broader issue of prescription affordability and accessibility with Halo Scripts. Now let's dive into how Halo Scripts is making it easier for patients to get their medications without the barriers of traditional systems. Okay, so I think it's all in the home go. So with Halo Scripts, our solution for optimized medication management, Halo Scripts provides a concierge pharmacy service that focuses on improving medication adherence while simultaneously reducing cost for both employers and employees. Through this service, we ensure that patients are not only getting the medications they need, but also stay on track with their treatment, which in turn helps to lower healthcare costs across the board. With Halo Scripts, we are tackling one of the biggest challenges in the healthcare system, ensuring that patients can afford and adhere to their medication treatment without barrier. Halo Scripts uses a set schedule of 90-day prescription refills. So very similar to Good Shepherd, but instead of operating from business to consumer, we actually operate from business to business because we work with the employers, which ensure that medications are delivered on time, every time. As you can see, refills are shipped out to be delivered on or right before 4 key dates each year: February 1st, May 1st, August 1st, and November 1st. For any new prescription started between these fill dates, we ensure patients receive enough medications to last them until their next scheduled refill. So again, it allows us to continue to manage everybody as a group. We ship prescriptions via FedEx, UPS, and USPS, and tracking numbers are always emailed to the patients once their prescriptions are shipped, giving them a full visibility of the status of their medications. It is important to note that we don't handle any controlled substances or any medications that would be prone to misuse. We understand that managing chronic conditions often involves working with multiple prescribers. That's why our chronic care management team collaborates with each patient's medical team, which typically includes 4 or more prescribers. Our goal is to optimize drug therapy treatments and ensure that all prescriptions are synchronized. This way, the patient can have their medications managed on the same refill schedule, with refills being delivered on the key dates as noted previously. By aligning prescription schedules, we make it easier for patients to stay on track with their medications, reducing confusion and avoiding missed doses, ultimately improving health outcomes by maintaining a PDC greater than 80%. At Halo Scripts, customer service isn't just an add-on. It truly is the core of everything that we do. We focus on providing a seamless, supportive experience for every patient at every stage.
Michelle, can
Yes.
I ask a question
Yes.
on that last slide? Just for the audience, because I had some students ask that question last week. Can you explain what PDC means and how that's an adherence measurement?
Philip, I'll let you answer that.
Not cool. PDC, okay, so put me on the spot. Percentage of days covered has to do with when the meds are refilled, not necessarily when they're taken. It's not an excellent measure, but it's the best measure we have in the literature, percentage of days covered. So 80% or greater is considered to be adherence, and less than 80% PDC is non-adherence. But it is a measure of when the prescriptions, how many days in a 90-day period did the patient at least have the medication in their home according to when they refilled it. Since all members are synchronized and on the same schedule, they're theoretically at 100%, and it's up to us to mess that up and bring it down.
Yes. And that's what a lot of, like Medicare plans are graded on, insurance companies are looking at, and it's in the literature. But I was using that term last week, and my students were like, I don't know what you're talking about. So anyway, thank you for explaining that.
Yeah, my pleasure.
So yeah, at Halo Scripts, customer service isn't just an add-on. It truly is the core of everything we do. We focus on providing a seamless, supportive experience for every patient at every stage. Starting with our onboarding experience, we received a stellar 4.96 out of 5 stars from over 100 reviews. This reflects the time and care we put into ensuring that new patients are not only comfortable, but fully informed about how our services work from the very beginning. When it comes to refill experience, the story remains the same. We maintain an impressive 4.94 out of 5, showing that patients trust us to deliver their medications on time, hassle-free. Our overall customer service experience is where we truly shine, with a 4.97 out of 5. This consistency across all interactions demonstrates that whether it's a routine refill or addressing a unique concern, our patients are highly satisfied. One of the most telling metrics is our Net Promoter Score, or NPS, which means how likely our customers are to recommend us. Halo Spriggs has an incredible score of 91. So to put that into perspective, the average score for insurance companies is only 35, right? For traditional pharmacies, there's a whopping 28. And for specialty pharmacies, it's about around 78.6. A score of 91 reflects our ability to build loyalty and trust amongst our patients. So whether it's onboarding, refills, or overall care, we focus on creating a service that patients love and can rely on. Customer service really is our thing, and these numbers speak for themselves. We provide significant benefits for both the employer and the employee, creating a win-win situation. For the employer, the primary advantage is reduced healthcare costs with better medication management and adherence. Employees stay healthier, which leads to fewer sick days and increased productivity. When employees are following their treatment plans, the entire company benefits from a healthier, more productive workforce. On the other hand, employees gain from having no copays, free shipping, and personalized medication management. This makes it much easier for them to stay on top of their medication routines without the financial burden or the hustles of complicated pharmacy interactions. By removing these barriers, both employers and employees are better positioned for the success of their companies. As you can see, the members really value our personalized, high-quality service that we provide. Here are some examples of what they are saying about it. The first testimonial highlights how our team makes clients feel comfortable and confident in the service they receive. This member expresses how much they appreciate the personal care and trust that our representatives build, saying they would give our staff a raise if they could. In the second testimonial, another member, who is a lifelong salesperson, recognizes how important customer service is to our organization. They specifically called out the outstanding service and the care we put into every interaction, saying it was clear that customer service is a top priority for us. There are just a couple of comments we receive regularly, but they show you how much impact excellent customer service can make building trust and long-term relationships with our members. So as we look to the future of medication access, Good Shepherd Health is focused on expanding our programs to make an even greater impact. On one hand, we envision further enhancing medication access for underserved populations, helping to lower healthcare costs and ensure that no one is left behind due to financial barriers. Our goal is to continue making life-saving treatments available to those who need them most. On the other hand, we are also focusing on developing cost containment strategies for self-funded employers, helping them to manage healthcare expenses while providing their employees with affordable, high-quality medication management. By balancing these two goals, serving vulnerable communities and helping employers manage costs, we are shaping the future where medication access is both affordable and sustainable for everyone. Our existing infrastructure at Good Shepherd Health is made up of a comprehensive network of services that work together to ensure seamless medication access and management. Under the Good Shepherd Health umbrella, we manage services such as chronic care management, prescription fulfillment, delivery, supply chain management, and even medication recycling. Through programs like Halo Scripts, we optimize chronic care and medication adherence, while Remedy Chain allows us to reclaim and redistribute unused medications. Our Good Shepherd Pharmacy is the backbone that supports prescription fulfillment, ensuring medications are delivered efficiently to those who need them. This integrated network allows us to provide high-quality, affordable medication access while maintaining a strong focus on sustainability through our innovative initiatives. So as you guys have seen throughout today's presentation, Good Shepherd Health has developed innovative solutions like affordable pharmacy services, medication recycling through Remedy Chain, and digital platforms that are making significant impacts on the underserved population. However, to truly scale these solutions and reach even more people, we need partners. I encourage each of you guys to think about how your organization or institution can join forces with Good Shepherd Health to expand these services. Whether you represent a healthcare, as you represent as a healthcare provider, an employer, or a community organization, there are many ways you can get involved. Healthcare providers and clinics, and you guys can collaborate by referring patients who need affordable medications or by integrating Good Shepherd's digital platforms into improving medication adherence for your patient population. Employers, you can partner with us through programs like Halo Scripts to improve employee health outcomes and reduce your healthcare costs, all while providing invaluable services to your workforce. Community organizations and advocacy groups can help by spreading the word, raising awareness about our programs, and assisting patients in navigating the process of obtaining affordable medication through Good Shepherd Health. By partnering with us, we can leverage the strengths of our respective organizations to create broader, more impactful networks that ensure no one has to go without medications that they need. Together, we can transform healthcare for everyone. In closing, I hope today, in today's presentation, has given you guys a deeper understanding of the impact we are making here at Good Shepherd Health through our innovative programs. We are committed to breaking down barriers to medication access and ensuring that no one is left without the treatment that they need. But this is just the beginning. With your support and collaboration, we can continue to expand these efforts and reach even more people. That way, less medications in the Remedy Chain program is expiring in our hands and actually making it to the end users. I want to thank you guys for your time and attention today, and I would love to hear your thoughts and answer any questions that you might have.
Thank you.
I survived it.
You did. That was amazing. Thank you so much. I know from my experience, if anybody is local or if anybody has the opportunity, that Michelle and Phil are more than willing to give a tour of their operation. And it really gives a different perspective to see kind of the hands-on type of thing that they work on. So that really is very interesting. Can you tell us a little bit about the demographics and why you decided to start it in this area? I mean, I know that you are from this area as well, but why do you see the need where we live and where you are?
Well, we started the charity pharmacy here in the Hickory Ridge Mall, in a poorer part of town, and specifically to focus on Memphis, and that is where our pharmacy is and where our heart is still. However, we've grown to be licensed in 30 states. And when it comes in regards to like the chemotherapy reclamation program, we're accepting donated meds from all states, and we're matching those back out in states that allow it. Put it that way. And so we are bigger than just, we've grown beyond the Memphis community in that regard.
But it started here because Memphis is a blue collar. There is a bit of, I guess, I don't know what the stat is, but there is a higher population of marginalized patients in the Memphis area. Started home.
I have a question. So I saw that you have some ratings, so based on their feedback, right? So how many sample do you have? I saw one of them is 4.97, and there is a number of record is probably 100, something like that.
Yeah, we polled 150 patients and 100 responded, and that's what we got.
It's like 109. Yeah. So those, you can pull that slide back up, Michelle. The slide showed us NPS score and then how many responded in each category.
So how many total number of sample about that feedback from the patient you have?
How many did we send a survey to?
Yeah. So how many a sample you got from the patients? Response you got from them?
Negative responses. There were two. So, and there were, with the net promoter score, you categorize them, and I could be getting this wrong because I looked it up when I did it. You categorize them either as a 9 or a 10, and then intermediate, and then anything below like a 4 is a negative response. There were two. We sent the survey out to 400 patients, 110 responded. They didn't respond to all questions. So when she shows that slide, like it says 106 responses, 109 responses, but the survey went out to 400, 100-ish answered, and overwhelmingly positive.
Okay, got it, yeah.
Very full screenings and there's some. Well, we were looking though, it's like, it's not really done. This is it. Just
You used your one share.
yeah, no, kids slow. It was like you'll see like
Yeah, it's 106.
Oh, you guys can see that? Sorry.
No, go back, Michelle, you were good.
Okay.
Go, that's what he wanted to see. Yep.
So the total is 400 something, right?
I'm sorry, I didn't.
Now I'm saying the total review you received, it's around 400 in the 4 categories, right?
Right. So in those 3, yeah, because you've got a total of 3, look at them, 315 reviews for reviewers. Yeah. Across the board, total.
We send it to about 400 patients.
Mm-hmm.
Say 400 households. That's why it's a number lower than our number of patients. It was 400 households, 1 per household. We got 105 responses, 106 responses. One of them didn't answer the refill question.
Okay, so each household, so they receive the 3 categories of survey, right?
1, 2, 3. Yes, 3 questions.
Oh, okay.
Some other ones too. Rate us on a scale of 1 to 5 on these 3 areas: onboarding experience, refill.
Yeah, it makes sense. All right.
That's
Good question.
So how is the maximum score of the NPS score? Is it 100? What does it mean, the NPS?
Net promoter score, I believe, can theoretically go above 100.
Okay. No problem. Thank you.
Mm-hmm.
Would you mind sharing a little bit more, kind of like that story about the legislative changes that had to occur for taking back medications that had been dispensed, and how you formulated the fees and dispensing around that? Because that's kind of quite a story.
Well, when we opened the charity pharmacy in 2015, right away people started bringing us medicine that they wanted to donate, and it was illegal in the state of Tennessee at the time. And so we worked with legislators for a couple of years to get a bill passed that would allow us to accept donated meds in pristine condition, not in your amber vial. They have to be in manufacturer packaging. The first law said they had to be tablets or capsules only. So in 2017, the law passed, that allowed us to do tablets and capsules. It didn't allow us to do anything injectable or refrigerated or anything else at all. From 2017 to present, we have reclaimed oral chemotherapies because they're tablets and capsules, and most of them don't have to be refrigerated, and they're very, very expensive. The average bottle of chemo that we get donated will cost anywhere from $15,000 to $35,000 for a 30-day supply. So we have started initially accepting those. We've got, like today, we've got $25 million worth of chemo on the shelf. We've matched about 700 patients over 4 years who wouldn't have gotten chemotherapy from any other source. We get about $1 million worth of chemo coming in every month from all over the country at this point. And we're consistently matching like probably about 50 patients every month. Some are with us month over month, obviously, but most are not. Most are using us as a stopgap measure to get their first fill while they get into an assistance program or something that's going to be a long-term solution. We don't charge anything for the program. Going back though, so that was the first law was in 2017. Last year, we got a revision of that passed that allows us to do more than tablets and capsules. We can reclaim just about anything except for controlled substances or temperature controlled stuff. If there's no chain of custody, if it doesn't like come from the manufacturer, we can't do temperature controlled. But we can accept just about anything, big longer list on what we can accept, and then we can dispense that back out to a broader list of patients. The 2017 law said that the patients had to be low income and uninsured, which made a lot of sense at the time. But then we got all these cancer meds, and we found that uninsured patients never get a prescription for a cancer med. They don't make it that far along in the process. They don't see a doctor in it. And so we weren't able to match very many chemo meds with patients in Tennessee that were uninsured. They were all going back out of the state. With this revision of the law, we created a priority dispensing where it goes to an uninsured person first, but if there's not an uninsured person in need of that drug, then it goes on down the list to underinsured or someone who has insurance but they can't afford their copay, all the way down. So truly first come, first serve in terms of the meds. And then the income limit, we got raised from 200% of poverty level to 600% of poverty level. So we broadened the program as much as we possibly could. We have always been chemo. Now we're doing brand name drugs as well. We're seeing a lot of Eliquis donations. We've seen quite a few Xarelto that's gone right back out. Eliquis is a real pain point for your heart patients, I bet. And we're just kind of testing the waters on doing anything outside of chemo. We aren't ever going to just do everything. It's going to have to be, like I said, we don't charge anybody anything. We eat the cost of the shipping when a person donates the meds. That is today to say we send them a shipping label, they put everything in the box and we pay for it. It doesn't cost the donor anything to make a donation. And so we don't want people's trash. It's got to be something valuable like Eliquis that we can redispense. And so as we broaden the list of what we're accepting, we're just testing the waters there. And we're a staff of 4 people. So not like some big major corporation. We're working this into our normal pharmacy workflow. But yeah, that's the history of the law in 2017. Last year, it was effective as of 1/1 this year to broaden the use of the program.
This is another thing. I know Michelle mentioned this about just visually seeing it is really interesting. And our implementation science people, there's so many questions that kind of come up where a lot of the packaging of the medications has to do with the recommended dosing schedule, starting it, titration of it in the clinical trials, or for adherence or compliance or what have you. But in real life, how does that happen? And so then why are we getting piled up these boxes and boxes of certain medications over and over and over? So what you're seeing is maybe the intention and the implementation are not matching up. And as Phil mentioned, the intention of the original legislation, with it being we're only wanting to help underserved people or low-income people, the administration of that particular law didn't actually line up with who needed it and things like that. So there's so much to really be learned in just a couple of years, and how they were able to work with a lot of different people to move that around and be able to work within the constraints. And a lot of that really does go back to that big question that people everywhere ask, like, why are drugs so expensive? This is one of those little bitty pieces of why. That there's no easy answer to that, but this is one reason. So I think it's so interesting. Does anybody else have questions that we have here?
I had a question just about the barriers and challenges that you feel like we still face in such an endeavor.
I think just visibility, right? People don't necessarily know that we are there until they find out about us and be like, oh my gosh, I wish I had known about you guys 6 months ago or a year ago. So I think one of our biggest pain points is visibility.
That makes a lot of sense. And I wanted to let you know that we would be, within the next week, turning this recording into a webinar and putting it on our site. And we do get quite a lot of traffic on our site, and we'll continue to publicize this webinar and also our past ones. And so we hope to help you get out this valuable information for others.
Thank you.
Thank you.
Thank you guys so much for having us.
Thank
Good
you.
job. Thank you.
Yes. Thank you, Michelle and Phil, and we will see you all soon. Thanks. Bye-bye.
We hope that you've enjoyed today's webinar. For more information and resources, please visit our website, tnhearthealth.org. You can find more webinars under our resources page. You can also follow us on Twitter, LinkedIn, and YouTube. Please let us know if there are any specific topics or speakers that you would like us to present. Lastly, tell anyone you know who would be interested in helping to decrease the burden of cardiovascular diseases in Tennessee and share the webinar. Together we can achieve our goals of managing and preventing heart attacks and strokes for Tennesseans.